This is, of course, the Nutnfancy project. It is 2014, and I am very blessed to be in front of the camera tonight. If you've been following my Twitter feed, that is www.twitter.com/Nutnfancy, you'll know why. I have been fighting a very serious infection over the last 14 or so days, and while I sat there in bed with my leg elevated, hot compress, fighting this very serious infection, which I will give you details on here in a little bit, I asked myself, and this is what we're going to talk about a little bit in this kind of fireside chat here in TMP. I asked myself, in a without rule of law situation, would I survive this? I thought about it a lot. If you remember my video, Without Rule of Law, Don't Hasten the Day, originally posted in 2008. I redid it a few years later, re-uploaded it. It's still out there. I make the point in that video that when we lose emergency medical services, and I'm just going to concentrate on that. There's a lot of things that will go down, but EMS, or just medical services, especially specialized medical services, millions of people are going to die. I fell into that category in the last 2 weeks. Without modern antibiotics, I feel at the very least I would have lost my leg. At the very worst, I would have died. So the lowdown on that is on the 21st of January 2014. I got a boil on my leg. Never had one before. Don't know how I contracted it. I'm a relatively healthy dude, 29 years old. Okay, a little bit older, but I'm healthy. I'm relatively in shape. I exercise. I generally eat right. Bang, this comes on my leg. I don't think too much about it. In fact, it happened when Mrs. Nutnfancy and I were riding motorcycles out in California, and I felt the pain in my leg. It's like on my inner left thigh, and I was like, man, that hurts. I didn't know what it was, an infected hair follicle or something. Well, it came on pretty strong, and then we got back that night. I looked at it, and I won't bore you with all the details, but I will give you a timeline to show you how rapidly things can progress and change your life for the worse, and how something that seems so innocuous can kill you, even today. So I go back and, I cover it with Neosporin and a bandage, and I don't think too much about it. I'm like, okay, it's going to run its course. If it doesn't get better, I'm going to get on some antibiotics. Fast forward to the 21st. It was getting much worse. I called, we have with our insurance like a 1-800 number we can call and get on antibiotics. And I told him what's going on. I was like, I'm concerned about this. The area is infected. It's getting larger. I think I need to get on antibiotics ASAP. And so at the time he prescribed this. I know we have a lot of medical professionals who subscribe and watch the Nutnfancy project. Many of them are my friend. This is it. It was the generic for Bactrim. Okay, orally taken twice a day. I think it's 800 milligram tablets. It's actually sulfamethox. So I think it's a sulfa-based antibiotic. I think you guys will like this medical discussion because there are some distinct lessons you might pull away from this for your own level of preparation. And that's really what I would like to do with this video. So on the 24th is when I got on the Bactrim. It kept getting worse. And I was at my job working, and it was worse. Every day it was extremely painful, hard to walk. It was like a mini volcano on my leg, this boil coming up, which is, by the way, staph bacteria, right? Staph infection. Finally, I was like, I got to do something. This is not good. And at this point, I looked like on the night of the 27th, I was worried about my leg because I could see the infection was going deep. It was expanding. And whatever I was on at the time wasn't cutting it. So I came back. And I went to an Instacare, hooked into some good doctors there. They looked at it and they go, that's bad. And we're going to put you on a Rocephin antibiotic IV until we can see an improvement. Now at the time, they didn't take a culture. They should have. The first doctor, the reason I think he did not take it is because I was already on Bactrim. He didn't know if the culture would test well. It kept getting worse. That's why you haven't seen me in front of the camera for a while. Really. In the last 10 days at least. And by the way, when I filmed Questions of Nutnfancy, it was happening then. I had it, and I wasn't really worried about it. I was thinking, oh, you know, I'm on antibiotics. It'll cure up on its own. And trust me, there's a lesson of all this, and that's why I'm telling you it. So, Rocephin IV, I came in multiple days. It turned out to be 3 days straight. I was on Rocephin IV. Took about half hour to administer. Plus the Bactrim. They kept me on that. It kept getting worse. I was scared. And I know that even with our modern technology, our modern antibiotics, that people lose their legs all the time. It happens. That infections, for whatever reason, they just get out of hand. And even modern medicine, in a rule of law situation, you know, it isn't enough to save that leg and sometimes save the person's life. And I know the medical professionals who watch this will be nodding their heads going, that's right. It's just, we do the best we can. We can't. One reason for this is because people have abused antibiotics, and the strains of bacteria that are out there are very strong and very resistant to what we have, our antibiotic technology, and that's a bad thing because people stupidly, unwisely, and ignorantly abuse these. And so when someone gets sick, you know, in past days they were able to handle it down here with an antibiotic that was, you know, an all-spectrum antibiotic, a broad spectrum. Not anymore, and that was my situation. So in the middle of last week, I went in, saw an outstanding doctor. He looked in, he's like, did they take a culture? And this was again going to Instacare because I couldn't get in anywhere else. And I said, no, they didn't. He's like, we need a culture immediately. Also, did you get a tetanus booster in the last 10 years? I knew I had one in the military. I don't want to bore you with all this. I got a tetanus booster. Fast forward 2 days, it's still bad. Slight improvement, nothing great. The culture comes back and it says it's the MRSA bacteria. MRSA. If you're interested, look it up on Wikipedia. It's nasty. It's a kind of infectious bacteria that will just destroy flesh. When I had gone in that day with that particular doctor, I'll call him Dr. B, he actually, and the other doctor had too, they cut open the wound and they just dug it out, and not a lot of pus came out. It was just dead flesh. And they have a medical term for this. I forgot what it was. And so, yeah, I'm worried. The morning they said, hey, that's MRSA. They took me off the Rocephin because apparently Rocephin does not attack that particular strain of bacteria. They said Bactrim does. And then the terms gram-positive, gram-negative came into play. And again, the medical professionals and nurses watching this will know exactly what I'm talking about. And they're like, we need to get you to a wound clinic. So a couple days ago, I went to a wound clinic. I tweeted this to my guys. And I'm happy to report that we were able to turn it around. They also went into the wound. They dug some stuff out. But oddly, they didn't put me on anything new. They said, hey, that Bactrim you're on is enough. The sulfamethox, which is generic for Bactrim DS, I guess. And also, I forgot to mention this. I was also put on cephalexin, which I think is like a Keflex. They took me off that. Sent me home after cleaning it out, and the whole time I'm bedridden, hot pad, trying to pull that infection out of my leg and worrying until probably the 31st, which is just a couple days ago. I'm filming this on the 2nd, and I'm still not completely out of the woods. It's still on my leg. It's there, but I feel like it's stabilized and it's not angry anymore. But yes, I feel like in a without rule of law situation, at the very least, I would have lost my leg, maybe my life, without modern antibiotics. So I consider myself a very prepared person. Well, not very, but pretty prepared. I mean, I have most of my bases covered. You know that watching TMP, right? Medically, I feel pretty prepared. I'm not like super knowledgeable on all this stuff, but I know the basics. I have the first aid principles down. I've talked about them a lot on camera. I have multiple videos out there on level 1, level 2 first aid kits, which have been standard setters for the industry in that people really have a usable first aid kit and they're able to attack and handle traumatic injuries. And I've heard from many TMPers over time that have done just that with their kits. But here we're talking about something different, and it's a good lesson for you, the viewer, the TMPer, for you to look at your system. And I'm going to concentrate only on this, a serious infection. which I think it will be a massive killer. Now, if you throw in gunfights or something like that into the mix where people are getting shot, you don't have EMS anywhere, you can probably imagine how bad an infection can be and how many people it's going to kill. Just look back into our history, 1700s, 1800s, and the Civil War. You know, what did they do? They amputated infectious to prevent gangrene. One or two things. They're going to go in and debride it, just dig out all the flesh. Any flesh that has died, they're just going to rip it off the bones. Painful. And by the way, it was extremely painful. I've endured probably, I hate to say it's the worst because I felt some pretty bad pain over the years, but it was pretty substantial pain as I dealt with this, as I dug it out. One used a local, the other one did not. Whatever. Pain is good, right? It's just weakness coming out. But let's think about that infection. Okay, so within a situation without rule of law, and to clarify, and if you're new to that term, it means, again, no emergency medical services, no police services. You can't go to an ER. You can't go to a hospital. You can't go to a pharmacy. All those things are unreliable. They're cleaned out. Riots, whatever. What you have is what you have, and perhaps you might be able to barter within your social system, whatever that is, might be your neighborhood. What do you have for antibiotics right now? Going back to my situation, I contract that, the MRSA bacteria, my whole leg's infected. I don't have anywhere to go. What would I have done? The first thing I did is I said, well, I do have some books, and I do keep some medical books on property for just this situation, because there's no way that us as lay people can know what a medical professional does. Now, granted, my son, Tactical Doodle, is an advanced EMS. He knows more than I do. He probably would have attacked the situation. But I went to these books and I was like, surely they have to have something that draws upon the centuries of knowledge of how people used to handle this before antibiotics. Have you ever thought of that? And I've mentioned this before, but oftentimes we think, oh, medical, the modern medicine is the only way to treat stuff. Not really. I mean, people lived and dealt with all the things we deal with now, well, most of them, with some degree of success. How did they do it? Were there herbal treatments? Were there home remedies? So the first book, and this will be kind of a mini review in part, is I picked up Where There Is No Doctor, a village healthcare book by David Werner, and this will be kind of a review of this portion. Oh, and I was like, okay, cool, boils and abscesses. So I go here. There's a section. I was like, oh, awesome, boils and abscesses. I go in there and I'm like, are you freaking kidding me? He tells you what it is. Put a hot compress over it. I'll just summarize this. Let the boil break open by itself. After it opens, keep using hot compresses because that helps it drain, which is effective. My doctor said keep it elevated. Keep it above your heart. Keep it hot and moist, and it'll help it drain. And by the way, I felt like that was outstanding advice. Elevated, hot, moist. Heat. So I had a wet washcloth that I sterilized in a bucket full of bleach, wrung it out. Next bucket was Epsom salts, wrung that out. I had a sterile dressing. Then I put the washcloth on top of the sterile dressing, elevated my leg, super hot pad. Sat there for hour after hour trying to heal. Fortunately, I did not get a fever, so that's good. If I had gotten a fever, then that's like a warning sign that your whole body is fighting the infection, and then your lymph nodes next will be attacked, and that's when they got to go to the next level. Back in the 1700s, they used to have I think like a standard of measure that if they thought an infection was coming on, within 6 hours they would amputate. Some doctors, from my understanding, which is quite imperfect, because they just didn't know what else to do. Back to this book, though, he talks about what it is. It's like the abscesses are very painful. No duh. Does not open after 2 or 3 days of hot soaks, and maybe you may have to cut it open so pus can drain out. This will quickly reduce the pain. And then I'm thinking, okay, yeah, I know all this. And he goes, if the boil causes swollen nodes or fever, take penicillin tablets or erythromycin. End of section. Then it goes on to something else. I'm like, why did I freaking buy this book? I mean, if my life depended on this and I cracked this book open, I would have been pissed. Fortunately, I had another book. And I bought this. I dated it. May 2011, Ditch Medicine. This one is by Hugh L. Coffey, and I will tell you this, it has some more useful stuff in it. Remember, we're assuming that in a without rule of law situation, either the antibiotics you have are inadequate, bold, underline, italics, by the way, on that, or you just don't have enough to finish the treatment. And let me talk before I get to the book about those 2 points. And what I learned from this MRSA, this MRSA infection, is that don't expect your amoxicillin to cure everything, or whatever other antibiotic you store up. Oh wait, you don't store anything up? Good thing you're watching this video. Well, let's say you have, I don't know, whatever generic, antibiotic you can get your hands on, cephalexin, you have that. Well, guess what? This cephalexin doesn't work for MRSA. Neither does Rocephin. I learned that. There's a picture of Rocephin in the book right there. And those are broad spectrum antibiotics. Again, the gram-negative, gram-positive strain of bacteria comes into play. That's scary to me as someone who wants to be prepared. Because now I'm going, holy crap. I thought I had 500 milligrams of amoxicillin stored up, and I'm not sure what the shelf life is on those. But at least I had some, but I don't know if it would have helped this. It may have made it worse. So, specific antibiotics for specific bacteria, modern medicine and rule of law can attack that. What are you going to do without rule of law? Again, back to my point. What did they do in years past? Well, I go in here, and I'm just going to summarize. I'm not going to read the book. This guy at least gives me something to work for or look to. He goes, hey, by the way, in the old days, they used to use sugar therapy. What? Never heard of that. Yes, granulated sugar. They would go in, debride the wound. Now think about that for a moment. It's on a very sensitive part of my leg. It went in pretty deep. Would have gone deeper had we not turned around. I think when I went to the wound clinic, they went into about ½ an inch. Cleaning it out, which isn't that deep, but is enough to cause me a lot of pain. And again, I'm a healthy male. Can you imagine if this would attack someone who was not healthy? So ½ an inch, they go and clean it out. And then whoever your medical professional is in a WROL situation, they go, I got to cut flesh off here. It's dead. So now you've got to have a sharp instrument to cut flesh out, to stop the spread of potential gangrene and losing that limb. And then in this book, he says, once that's been done, you'll flush it. He gives some ideas of what to flush it with. And then he will do a combination of granulated sugar, sucrose, and providine iodine, PI solution to enhance wound healing. And he has a great description of exactly how that works, what its downsides are, what its upsides are. Bang, that's what I'm looking for. Is some OTC method of that you can cure or at least have a chance of fighting that infection. Since the effect of granulated sugar upon bacteria is based upon osmotic shock and withdrawal of water that is necessary for bacterial growth and reproduction, this diluted syrup, which it turns into, has little antibacterial capacity and may aid rather than inhibit bacterial growth. But then he goes on to say, but if you change it frequently, it does have a chance. And then he gives some statistics of exactly how it's done it. Now, this is kind of a review of the book, and if you don't like gross pictures, turn your face, but we got to talk about something interesting here. This dude, a 19-year-old, was treated for a shotgun blast to the right foot, and the only way they treated it, and this is probably in a third world country, is with the sugar therapy that he said. So here's this. Dude has a shotgun blast to the foot, underneath side, and then the real work begins. They debride it. Basically, it looks to me like they cut a hole right through the dude's foot. Okay? And then they instituted the sugar therapy. I recommend this book, if for no other reason than the discussion, which is 1 chapter long on that, and then you can see the healing picture here. And this is without antibiotics. This is other post-healing pictures. There's his footnotes. Dude is Hugh L. Coffey. there's probably more home treatments out there that would give you a fighting chance. I think the best chance is you stock up, and this is what I want to hit hard. You stock up on as many antibiotics as you can get your hands on, with a huge caveat, and I really want to foot stomp this. Remember what I said at the outset. The reason why we have these resistant bacteria is because people have foolishly self-prescribed antibiotics in the past. This goes on a lot in Mexico, third world countries. It goes on a lot in the US too. People do and can buy antibiotics, you know, wherever, Canada, from Mexico, and have them left over from a relative. Or like myself, I have these left over because they told me to get off them midway through. Don't do that unless you know exactly what you're doing. Or if things are so bad, you just don't have any more options. Which honestly, in the situation I found myself in, I would have self-prescribed in without rule of law. So I don't have a hospital or institute care to go to. That's the foot stomper, is don't do it. Even though you may have, you know, because for instance, this Bactrim, I want to store this stuff up, dude. Totally. I want like a freaking huge bottle of this Bactrim. I want gram-positive, gram-negative antibiotics in storage. Again, I don't know the shelf life, but some shelf life is better than none. All of this is easily researchable in Wikipedia, online sources. You'll see a lot of comments to it as well. But prepare. Stock up. And then if it kicks off, pretend like you don't have that storage. You go to your doctor. You get tested. Hopefully, like I did, someone smart will test it. Come back and you get on an additional treatment. Just leave that for when you have no other options. Stock up. But here's the deal. It's not just antibiotics. And this is such an interesting insight to how difficult it is to prepare for every situation. And I don't think anybody watching this video will be prepared to a level to cover everything. In fact, probably most things you won't. My first aid supplies that I have, I feel like I blow the depth and breadth of most people away. They don't even compare. For instance, I have boxes of stuff like this. Gauze bandages, both like the Tefla, surgical sponges, gauze wraps. I have tapes. I have Neosporin. On and on it goes. In fact, you can see this, 808. That's a long time ago. I always date it when I buy it. That's probably when I was doing level 1 first aid kit. That date right there, because that's about when I came out with it. You need a lot of stuff. For instance, for my infection, let's say I did have to debride it. What are you going to debride it with? A knife? Well, we've reviewed some sharp knives here that are very capable of it, and I've talked to that in my reviews, that this could be a good surgical blade. One that would come into mind might be a Cali 3.5 Spyderco. That's awesome, with a wicked sharp edge. But still, your best tool is one meant for the job, and that's a scalpel, a set of scalpels. So that's something you might want to put on your list. Also, lidocaine. And I don't even know, I haven't even looked if you can get lidocaine, but can you get a topical, anything topical that can numb it? And I don't know, the shelf life on this is probably very short, but something where if you're going to go and debride that room like that dude's foot, can you imagine how much pain that guy would be in? As you're digging flesh out of his foot, out of my leg. Yeah, having gone through it recently, it's just mind-numbing. It's not good. Especially to us pampered modern people. We're not used to pain. I mean, the old-timers were always used to pain, right? They lived that way. Scalpels, you know, sutures. So now you have to sew up the wound. You're basically playing like a MASH unit. You are the doctor, you are the surgeon because no one else is available. Assume you have no access to medical professionals or people who have supplies. And I know doctors personally, they're my friends. I ask them all the time, hey, are you stored up with these things? Do you have antibiotics? Do you have suture kits? And their depth that they have is very, very small. They're going to run out basically in a week. So you can't count on that. You can't count on a clinic, raiding a clinic, anything like that. You got to have it yourself. How about gauze? Because I was exchanging bandages there for a time, 3 times a day. It was bleeding, coming out. I may roll in a picture here. I don't want to gross you out too much. Yeah, gauze. Have it on hand. What are you going to use? T-shirts? Sterile gauze. This stuff is cheap. This is, you know, get a big Rubbermaid container, an action packer of what I use to store it up in. How about bleach? That's something I didn't have in my storage. I was like, household bleach, wow. You know, how did I miss that? I don't know, because I was using it to sterilize that washcloth. You know, sterilize it into Epsom salts and have that stored up. That was a doctor's recommendation, by the way. Neosporin, how much do you have of that on hand? Or bacitracin, topical antibacterial ointment, which incidentally did not help at all in the onset. Remember, I told you I hit that Neosporin right off the bat, but the problem was the infection was on the inside. And once that infection is subcutaneous, it's going. You need to get into it and attack it with something, either an antibiotic or you're going to go in locally, clean it out, and pack it, like we discussed in that book, or he discusses. Tape, surgical tape. How much do you have on that? How much on hand? Heating pad. Oh wait, we don't have electricity. How are you going to heat the wound up? How they do it in the 1800s, 1700s, Civil War? Boil water. That's how. Do you have fuel to boil that water? Do you have a container? Do you have water? Getting back to my water storage video. Clean water. So, point is, stock up on this stuff. And we're talking about one isolated medical thing, infections. Although I will say it's going to be a big killer. And without rule of law, I think I've made that point in this video. And having experienced it recently, personally, I can attest that you'll be amazed at what takes over your body and how little control you have over it. And what shocked me is that, initially at least, how little control modern medicine had over it. Because here I was in treatment for 4 or 5 days, and it was still getting worse. And they're shaking their heads like, oh, we don't know what's going on. Why it ultimately turned around, I really don't have an answer for it. I think it was mostly my body, and I think the Bactrim helped. It wasn't the Rocephin, wasn't the Keflex. And I think it was, honestly, there's another point I want to make, PMA. By the way, that doesn't stand for what you think it does. It stands for positive mental assertions. Yes, I'm serious. Is that you have to will your body to heal. What are you talking about, Nutnfancy? I mean, you got to have a will to live. You have to have a will to heal yourself. Anybody who's done a lot of reading about human history, about war, has probably come across in either the Vietnam conflict, World War II, Korean conflict, even modern conflicts, Afghanistan, Iraq, where guys got hurt really bad and they survived because they had a will to live. Against all odds, they lived, survived, some even recuperate. I think that plays with any serious injury that your body is fighting. You have to have faith. If you believe in God, like I totally do, exercise that faith to heal yourself. And along with that is a positive mental assertion. I don't want this to get weird, but I'm dead serious about this. You have to open up your body's capabilities to actually tell yourself, and I was doing this like 10 times a day, my leg is healing, my leg is healing, my leg is healing. I was seriously doing this. My leg is healing, my leg. Say it out loud. My leg is healing. And then I close my eyes and say, my immune system is working. My immune system is working. I truly believe that helps heal the body. As opposed to sitting there, oh my gosh, I'm going to lose my leg. Oh my gosh, I'm going to die. I think you set in motion all the mechanics in your body according to your thought process. And in some ways, I really do. So positive mental assertions have to be a part of your healing process. If you're a faith-based person, I am, make that a part of the process as well. Don't expect your books to save you. They may let you down. And again, this is just infection. What if I had a compound fracture? Well, again, that could be infectious, right? Compound fracture, all types of crap gets in there. How do we set the bone? No doctors around. I don't have that much. Guess who's handling it? You are. Or the person dies. Now, in the Nutnfancy project, I've talked about that a lot. About you look left, look right. There's no one else there except you. This is what I want my viewers to be prepared for, because if you're watching this video, you're going to be the medical professional in your community, probably. And you're probably going to make some mistakes. You probably don't have, that great a knowledge, but get some good books. At least have them as a referenceable library, which I do. I don't like sit down and I just don't have time to study and become a medical professional, but I have great common sense. I do have a basis of first aid. When I have to, I can get bloody to save people's lives. I don't like it, but I can do it. So A medical library is good to have, and I really would like to see books, and maybe you guys will have suggestions in this. I don't know. Oh, and by the way, please don't flood my mailbox with all types of remedies because bless their hearts, so many people did that, and some were pretty whacked. I'm sorry, they were from my Twitter feed, and some were very good, and we learned from, but we just can't answer them all. So, but what I'd really like is the market to have something like the Foxfire books. If you remember, that is a series of books that captured old-timers' advice on all types of subjects. The Foxfire series did. We need to do that in a medical book. I know these books are making attempts at it, but we need more of that. I think this might be more battlefield wounds or something like that. I don't know. That's what we need. So what did the American Indians use? What did the old-timers use? You know, for instance, tobacco used to heal wounds. I once heard that. Crack open a book, says, hey, you got a boil, you have a serious infection, try this. Boom, 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 try this. That's what we need. And it might be out there and I missed it. Finally, I'm going to wrap this up. You will never be fully prepared, again, driven home to me in the last 2 weeks, for a lot of medical emergencies. You won't. You're going to have holes in your system. And we're just talking medical stuff. You talk about food preparation, fuel preparation, weaponry preparation. Okay, you guys are covered on that. I know. But medically, I doubt it. And a lot of you guys are going to watch this video and you're not going to do anything to improve your situation. And later you're going to get caught off guard. And this will ring true and you'll go, dang, should have listened to Nutnfancy back then and stocked up. You're never going to be fully prepared. It won't happen. Getting back to my other without rule of law video, sense of community. That wherever you are, you will have to bond together as a group, rebuild society, work together to establish peace and security in your community, and probably institute a barter system, and perhaps, just perhaps, you might have someone who has antibiotics, although I highly doubt it. One reason is they're very hard to get in the United States, at least illegally. You have to be prescribed. Shelf life comes into play, how effective they are. And then the specificness of the bacteria being attacked comes into play. You know, without being a medical professional, how do you know which one you're attacking? Again, we need a reference library. A book that says that. Says, hey, MRSA, look for this. Skin will look like this. Discharge will look like this. Here's some pictures. Boom, 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 boom. Pictorial that a dude, a layman, an average Joe can look at and go, MRSA, we recommend the following homemade treatments if you don't have antibiotics, but these are not preferred. If you do have antibiotics, attack it with this. And then give a chart. If the antibiotic is this old, 10 years old, expect this efficacy. Boom. How's that for an idea? Something that addresses realities. The people are going to be attacking this with old antibiotics. How effective will it be? What dosage should I have? How often should I have it? If it fails, what, American Indian or whatever pioneer remedies can I attempt? So hierarchy, do that. How do I debride a wound? Show it. That's what I like about this book, is he shows some great pictures that show you what to expect. By the way, I bought this from, what's the bookshop? I'll annotate at the top. I love that bookstore, but that's a great, it's just like Damage. I only paid like $4 for it. Damage, I don't see anything wrong with it. Anyways, that's it. Again, I'm grateful for all your guys' prayers for me. This was extremely serious. Maybe you've gathered that. The weird thing is I felt pretty good through it all because, again, we caught it early enough where the infection didn't spread to my entire body and overwhelm me. But I would probably be dead in WROL. Well, that's worst case. I would have probably lost my leg and hopefully caught it prior to that. And honestly, with how bad this particular infection was, MRSA, and we have no idea, again, where it came from, what I came in contact with, nothing. I'm really good about cleaning wounds when it happens. I just don't have that information. But it's a wake-up call. It doesn't, and I'll end with this, it doesn't really change my philosophy on life. And I already lived with no regrets. In other words, I was thinking, I was laid up, and I was like, what if this goes south and they cannot turn it around? Again, which happens in hospitals every day. I lose my leg or I die. I said to myself, well, I've had a pretty good life. I'd live it all over again. Live it all over again, is what I said to myself. That's what I hope you would do. Is if you died tomorrow, what would you change? You know, if you knew you're dying tomorrow, what would you change about your life? Are you happy with how you've lived? If not, you need to make some changes and you need to reprioritize things. Live with no regrets. And at least I had that going on. I was like, I don't want to leave now because I don't want to leave my family. You know, I don't really fear dying at all, but I don't want to leave my family unattended. I feel like I have an obligation to take care of them. Yeah, I would have died. Keep in mind, again, I was healthy. Someone who has this and their immunity is weakened with a sickness, they have a fever, dysentery, and then they get this. Dude, I know this is a serious subject, but I'm doing it to help you guys. And here in TNP, I'm all about truth and sharing it as I see it. So stock up. You need all kinds of antibiotics. I don't care where you get them, because you need them. Don't use them except in extreme emergencies, and you have to know what you're doing. Pretend like you don't have them if you get sick. Do not self-medicate with antibiotics, therefore WROL only. Date them. Find out what the life is, how effective they'll be. That other stuff I talked about, stock up on that as well, and still you'll be unprepared. This is Nutnfancy. Thanks for watching. Thanks for your prayers. Out.